Welcome back to the Lightning Step Couch here at Global Exchange 2023. My name is Benjamin Turner. I am your host and behavioral health advocate. Sitting to my left is Pam Mott. She is a licensed clinical mental health counselor with a private practice in Alton, New Hampshire. Pam, thank you so much for joining us.
Thank you.
Can you tell us a little bit about yourself and what you do there in Alton?
Sure. I'm a licensed clinical mental health counselor, and I provide services to families within a rural community.
Awesome, awesome.
hmm
We're going to jump right into a few questions here.
Sure.
What are the core principles and components of a trauma-informed approach?
Well, the first thing being safety.
Okay.
You have to have an environment of safety for people to be able to work through their stories and their narratives.
Okay, absolutely. Um, how can treatment plans be tailored using evidence-based trauma interventions?
When we're looking at treatment plans, we want to come into safety first and joining with a person. So, how is it that we can use what we know about the nervous system in order to teach people how to come to safety in their own personal space? So, when we're developing treatment plans, if we're looking at what we know around safety, we can engage in our narratives with individuals.
Okay. How do you utilize technology or innovation in your private practice, or do you?
I do. In private practice, utilize a digital platform, and then I also provide texting services to
Okay.
individuals,
Yeah.
and it helps me to stay connected with them.
Absolutely, and it helps them as well, I'm
Yes.
sure, so that they can have somebody to touch base with when they're not there sitting with you or in your care. So I think that's very important that you keep in touch with them. On that subject, what peer support roles can assist in providing trauma informed care?
Oh, peer supports. It would be great to have more connection with peers
Okay.
so that peers can talk to one another and teach one another what it is to be able to walk safely within their roles and in the community. I would highly encourage that. That's one thing that's challenging because of stigma. I don't think people like to expose themselves with their
Okay.
stories. So those peers that do come out and support one another, it's just a service that's requires courage, um, but it's a very brave thing for people to do.
Absolutely. Now you said that that's challenging.
Yeah.
Do you have ideas on solutions on how to better that?
Oh,
Okay.
community building, staying with your resources, encouraging people to speak about hard topics like
hmm
suicide and suicide prevention.
Okay. How do how do the patients or your clientele come into your care?
Some of them by word of mouth.
hmm
Some of them happen to find me by searching
Okay.
through online platforms. Happenstance.
Okay. Do you have a website?
I do not.
Okay. Okay. So people would just have to find, like you said, word of mouth. So
Insurance companies keep
okay.
lists of providers
Yep.
that are enrolled in their programs.
Okay.
So some people find me through their insurance companies, but again,
Awesome.
I'm a clinician in a small rural area, so word of mouth is incredibly important. I
It
have
sure
no
is.
advertisement,
Okay.
and
But
people
that
come
it's
to
great
me.
to serve a rural community. It's very underserved. And so how can organizations empower trauma survivors?
Organizations can import and
Or how can organizations like yours,
like mine.
yeah,
How can organizations like mine empower trauma survivors?
yes,
By giving them a safe place to tell their story
absolutely.
and then allowing them to feel safe within themselves so that they can go out and impact their communities and be involved
Okay. How did you get involved in this?
in mental health.
Yeah.
How did I get involved in mental health? Well, it started way long time ago in the 90s with work with children with autism.
Okay.
But it was relating to prevention of childhood abuse and neglect. So through grant writing, community building, and play groups.
Absolutely. The grant writing is not an easy process, but it can be fundamental to getting the funds that you need to provide
Yes,
that care.
yes.
How did you go about was that something that you came across, or did you go directly at grant writing? Was it?
No, I stumbled across
Okay.
it in an underserved area. We need people to be able to bring people together. So there was a need and an opportunity, and I took the opportunity.
Awesome. Awesome. One last question. What self care and secondary traumatic stress strategies are critical for staff delivering trauma care?
Oh, self-care.
Yeah.
Super important.
Yeah, it
Number
sure is.
one, if a clinician isn't taking care of themselves, they're not doing any service for their clients. For me, it's yoga.
Yeah.
Bessel van der Kolk said this morning that yoga is a very effective treatment for people that are handling PTSD-like symptoms and trauma. So in terms of clinicians taking care of themselves, I would say yoga,
Mhm.
meditation, breath work, exercise, community building, recreation, and play.
Yeah, absolutely. Yeah. Selfless plug here. My wife and I are both yoga teachers, so we know the
Oh, that's great.
importance of that for our own well being. And it's clear that that would absolutely benefit those that are dealing with
Yeah.
trauma and PTSD. Pam, is there anything that I've missed in this conversation that you want to get across to our guests here at GXC, or just anything that's important for you to make sure people hear?
Well, I think for clinicians, it's taking care of yourself because the better you take care of yourself, the better you serve your clients.
Okay. You're in a private practice. But how can larger organizations, if you have any insight into this, how can larger organizations support their staff in that way?
Well, coming from community mental health, that is a large
Yeah.
organization, and I would say that they do need to do more to protect the health of their frontline workers.
Okay.
So increased communication, more effective treatment, educational opportunities,
Hmm.
better pay,
Yeah.
uh,
Absolutely.
safer
Yeah.
standards, support.
Hmm.
All these things are foundations
Does
because
technology play a role in that?
um, in community mental health, technology can play a bigger role. I have not been in it for quite a number of
Okay.
years, so I
Mhm.
can't speak to what's there now. But when I had previously been in it, it was an underutilized resource.
Absolutely. Absolutely. Well, Pam, I appreciate your time on the
Thank you.
couch today. Um, other than the fact that we're here in Disney and we get to go hang out in Epcot tonight, what brought you to GXC?
Oh, the collection of professionals that are talking about this very important work.
Absolutely. No, I think it's one of the most beautiful gatherings of people. We're all learning a ton. We're all sharing some great ideas. And I think it's great that people are bringing us all together to do that.
Oh, for sure.
Pam, it's been a
Thank you.
wonderful time here on the couch. I appreciate you joining us.
Thank you.
Check out Pam Mott if you're in Alton, New Hampshire. Uh, she can provide some great services for you. Thanks again.
Thank you.
Awesome.